Welcome back to another episode of Veteran Oversight Now, an official podcast of the VA Office of Inspector General. I'm your host, Fred Baker. Each month on this podcast, we'll bring you highlights of the OIG's recent oversight activities and interview key stakeholders in the office's critical work for veterans. This is a special hotline edition of Veteran Oversight Now, and joining us today is Trina Rollins. Trina is the Director for Hotline Coordination within the VA OIG's Office of Healthcare Inspections. Trina is a board-certified physician assistant who worked at the VA North Texas healthcare system for 8 years prior to joining the VA OIG in 2011. Trina, welcome to 2024.
Thanks, Fred. I'm glad to be back doing podcasts.
Yes, well, we are back from an extended absence for the holidays and for some of the other products we were producing. We are glad to be back. We are here today to discuss the healthcare inspection, the delayed receipt of patients' colorectal cancer screening tests at the Phoenix VA healthcare system in Arizona. Trina, as we do in the other reports for the audience, can you kind of describe the size of this healthcare system and give us a little context?
Sure. This Carl T. Hagen VA Medical Center is the VA in Phoenix. It has 10 associated outpatient clinics and is part of Vision 22. It is a 1A high complexity rated facility within VA and provides healthcare services including primary care, long-term care, and specialty services such as surgery, neurology, oncology, dentistry, geriatrics, nutrition, psychiatry, and physical medicine and rehabilitation.
Great. Thank you very much. So as the name states, we're here to talk about the delayed receipt of patients' colorectal cancer screening tests. Start out, though, how did this hotline inspection end up in your office?
So we actually got a complaint stating that there were over 400 of these test kits that were delayed in being delivered to the VA. And the backstory on this is that the FIT test, if you're not aware, a FIT test is a way of screening for colorectal cancer. And it is a home test where the patient receives the test from the VA, will take it home and actually use the manufacturer's directions to complete the test. It consists of taking a stool sample and packaging it and then mailing it back to the VA. So,
mailing it back in a self-addressed postage paid envelope.
Correct. And so, yes, so those postage paid envelopes will go to the U.S. Postal Service and then get delivered to the VA. Well, in this case, unfortunately, there was a bill, an unpaid annual fee, and the Postal Service held on to these tests. And it wasn't until a very conscientious U.S. Postal Service employee noticed that these test might be important and called the VA and said, you've got an outstanding bill here and we've got a large number of these tests that need to be delivered. And then that just snowballed into several other things that happened.
So before we move into all that, let's go back and talk about these tests and the importance of the role they play in ongoing health care for veterans.
Sure. So colorectal cancer is the third leading cause of death in cancer death in both women and men in the United States. And most of the colorectal cancers arise from precancerous growths or polyps. I think most of our audience has actually heard of a polyp before that form in the lining of the colon. And these polyps are normally non-cancerous, but over time could develop into cancer. So that's the reason you want to get screened and get screened early. And the way to screen for colorectal cancer is two ways. One is a stool-based test, such as the FIT test, the fecal immunochemical test that the VA uses,
which we're talking about for the purposes of this.
Which we're talking about for this project, yes. And again, that test detects the presence of blood in the stool, and having blood in your stool doesn't necessarily mean you have colon cancer, but it is an indicator of that. So it means if there's blood in the stool, you want to get checked out and have further testing done in order to check for that cancer. The other way to test for colon cancer is direct visualization through a colonoscopy.
Sure.
So that's, is it an invasive procedure using a camera, and they go up into the colon and look around to check for any type of polyps or any masses that may indicate cancer. So as I said just previously, the VA's preferred method, or the method that VA use preferentially, is the FIT test, and they recommend screening patients from the age of 45 to 75.
Sure. But it's definitely, as far as preventative medical care, a very important test, because if anything, if there is a positive, that allows them to go to the next step, have a colonoscopy, have a more detailed test, and then they could proceed from there.
Exactly.
Right.
And this screening test is recommended to be done annually.
Sure.
So the FIT test.
So, and let's talk about the number too. I know there were over 400 tests that were at this non-VA warehouse. That sounds like a lot of tests for a medical system. Is that a lot? Is it?
Not necessarily. With these tests, they were collected over a period of time. So, when a patient gets the test, they can go home and do it immediately, or they may want to wait a few days, or if they're going on vacation and decide, I'm going to wait until I come back from vacation. So again, that time frame is dependent upon the patient when they complete the test and when they pop that envelope into the mailbox.
So it's a lot of tests, but it wasn't necessarily a stockpile.
No, and then you got to realize too, Phoenix, the size of Phoenix, and this is a screening test that's meant to be done annually for patients between the ages of 45 and 75. So that's quite a bit of the VA population.
Right.
So 400 may actually be on the low side for a month or two.
Right.
So
I got you. So before we get into the details of the who, what, when, where, how, let's talk about the time sensitivity, and then discuss the potential for false negatives a little bit.
Sure. So according to the FIT manufacturer's guidelines, once the stool is collected and placed into the vial that is needed to carry the specimen, it's only stable for about 15 days at room temperature. If it's refrigerated, then you can add another 15 days, so it's stable for about 30 days. But, in reality, if you're putting this in your mailbox and it's being picked up by the Postal Service, it's not going to be refrigerated. So they have about a 15-day window to collect the sample and then process it and test it.
And this storage facility was not a refrigerator storage facility.
No, it was not.
Right, so
and
we're on a 15-day countdown.
Exactly. And then the reason for that is, the test is looking for blood in the sample. Blood actually starts to degrade over time. So after about 15 days, even if there was blood in the stool, it would have degraded enough to where the test wouldn't have been accurate. So it could give you a false negative result.
So more than 400 of these were held for about 60 days. That's well outside of that stability period.
Exactly.
What happened to those?
So when they got the test, the facility actually worked really quickly to identify all of the patients affected and developed a plan for follow-up. So they had the names of all the patients because on the vial of the stool sample, they had to put their name on the stool sample. So they had the name of the veterans. They looked in their medical record to see if they had completed any type of colorectal cancer screening. And if they didn't, then those patients were marked as needing to be rescreened. And so what they did was sent out a letter explaining to the veterans what happened and that their test couldn't be processed, and sent them a new test kit and this letter of explanation, and asked the veteran to submit another sample for their screening test.
So it sounds like they took fairly prompt action on that part of it.
Really prompt on that part, yeah.
And you say it centered around an unpaid postage bill. Was this just a breakdown in communication?
Unfortunately, yes. What had happened was the supervisor for logistics was responsible for paying the bill. Well, the supervisor changed in March. The previous supervisor left in March. A new one wasn't hired until April, or didn't come on board until April. So there was this lack of communication during the transition. So some knowledge was lost, and realized the new supervisor didn't realize that the bill was outstanding, and it wasn't on their radar to pay until they actually got the notification from the U.S. Postal Service. That has since been corrected, though, because again, this is now they move forward and set up an automatic payment system. So
yeah, that's what I was going to say. And now it's on auto pay. So
exactly. So there's no risk of unpaid bills in the future.
Now there were some other allegations in this complaint that we didn't substantiate that were related to these samples, correct? Or these tests?
So there was an allegation about loss of protected information, but that was not substantiated. The samples, again, in order to find out who the sample belonged to, the veteran had actually placed their name on the sample, and those samples were placed in the appropriate type of container to dispose of them appropriately, and so that was not at risk for being lost or available to public use.
But there was one additional concern that we found as we were working through this inspection, correct?
So there were actually a couple, a couple, because we found that the laboratory staff were misinformed or had a misunderstanding of the stability of the test kit. They felt the test kit, or they reported to us that they thought the test kit was viable for 30 days. But when looking at the manufacturer recommendations, it's viable for 30 days in a refrigerated setting, but only 15 in a room temperature setting. So, but on top of that is determining what's the start time for that 15-day period. What we found was that the vial for collection had a pre-printed label on it, so it had the patient's name and the appropriate identification for the patient, but didn't have a place on there for the patient to actually mark the date they collected the sample. Without that date, you don't know when to start. When does the clock start? The laboratory staff were using the date that they received the sample. Some staff were using the day the order was placed. So again, you can see where there's variation in that. And so again, we needed to ensure that there was a known start date. Otherwise, the reliability of the testing was at fault.
So just so we're clear, were there samples that were tested outside of what would be viewed as their stability date?
Yes. Previously there had been. Now, of the samples that were taken, that were from the Postal Service this time, there were 3 samples that had enough information on there to verify the collection date and be within the time frame to actually be processed. The other 403, I believe, were not processed. So again, they didn't go through the accession, meaning they weren't linked back to the patient's medical record. The testing of the sample didn't actually occur. And so with that there was a lack of communication to the primary care providers who had ordered the test. They have this order out, this outstanding order for this colorectal cancer screening test, but it was never actually done, even though the patient had sent in a sample. What should have happened was that the sample should have been assessed, linked to the initial order, and then a comment placed that the sample couldn't be run. And given a reason, and the
Sure.
reason would have been it was outside the stability period for the test.
So what were our recommendations?
So our recommendations, we had recommendations at the VISN level as well as the facility level, and we recommended the VISN provide oversight of the facility's review of their laboratory processes related to these FIT tests and processing of these tests, as well as evaluation of patient impact of the potential false negative results. Because remember, we pointed out that the lab staff had the misunderstanding that the tests were stable for 30 days. And then on top of that, they didn't have an actual collection date that they could start the clock on. So they ran many tests in the past with that incorrect
Right.
knowledge. And so it could have been that they had many false negatives during that time frame.
So we made a recommendation that they relook at that. Did they take any action on that yet?
They have. So a couple of things have happened. The VISN actually led a stand down at the facility to retrain all of the laboratory staff about the test, about the accessioning of the test and processing it. And then they also passed all of that information to all of the other facilities within VISN 22. So it wasn't just Phoenix, they made sure all of the facilities in VISN 22 had the same information and the same knowledge. So to follow that up, they're doing weekly audits and checking to make sure that the logging process is being done correctly. And so far, the reported compliance has been 100%.
Did we have any other recommendations?
We did. We had some recommendations for the facility and to, again, review and ensure compliance with these FIT testing process, as well as doing an evaluation of the whole system, the process, and to determine if there's any practices they needed to correct or if they could improve the process in any way. And then finally, to modify the facility's pre-printed label to include the date the specimen was collected. So again, they put the label on the vial in order to help the patient out. It's identified, it's got all the appropriate identifiers for the patient, but it didn't have a place to put a date as to when the specimen was collected. So they've since reprinted those FIT labels to include the date of the specimen collection. And I thought what was really interesting on this was they actually they collaborated with the supplier of the FIT test to revise the collection instructions as well, so that it says in the instructions to make sure you put the collection date on your label.
So we actually cover a lot of pretty tough topics in this hotline podcast. This actually sounds almost like a good news story in terms of the outcomes.
It's good news in terms of the outcome, definitely. The OIG staff had done a preliminary review and didn't find any patient harm as a result of these delays, but we did recommend that the facility and VISN oversee a further look about that. And then again, the processes that we found that were deficient, they very quickly made changes in order to improve the process. And I'll also say too, VHA as a whole, VACO, released an operational memorandum back in October of 2023 and gave guidance on what to do if the FIT test or the test sample has a missing collection date. They actually provided language to put into the medical record so that the provider that's ordering it and the patient, when they receive their results, would have an understanding, that the results could be, or the results could be impacted because they didn't have a collection date on there.
So a lot of impact VHA wide from this one oversight report.
Exactly. Very positive.
Great. Is there anything else you'd like to add, Trina?
No, I think that covers it. I think it was a very interesting hotline, an interesting report, but again made impact at Phoenix with Vision 22 as well as VACO wide.
Well, thank you, Trina, for being here. As always, we appreciate your input, and we look forward to our next podcast.
Thanks, Fred.
As mentioned in this podcast, you can submit a complaint to the VAOIG by phone, 1-800-488-8244, or you can go to our website, www.va.gov/OIG/hotline, and fill out a hotline complaint there. However, if you are a veteran in crisis or someone who is concerned about one, please call the Veteran Crisis Line, dial 988, and then press 1. Now let's go to Lauren for the highlights of our oversight work for this past month.
Thanks, Fred. In January, our Principal Deputy Assistant Inspector General for Healthcare Inspections, Dr. Julie Kroviak, testified before the Senate Committee on Veterans Affairs. Her testimony focused on repeated deficiencies identified by the OIG's proactive Vet Center Inspection Program. Vet centers are community-based counseling centers providing a wide range of social and psychological services to eligible veterans, service members, and their families to support a successful transition from military to civilian life. Dr. Kroviak lauded the dedication of vet center staff while recognizing that the limited progress by these centers over the last 3 years, particularly for suicide prevention activities, suggests that barriers remain in improving and sustaining compliance with critical VA policies. She called for stronger leadership engagement and continuous oversight of the staff's daily activities, particularly when working with veterans at high risk for suicide. In response to questions, Dr. Kroviak suggested that vet center directors would benefit from reviewing all of the OIG's Vet Center Inspection Program reports, and that focusing on clear and consistent communication with VA medical centers would help improve vet center performance and outcomes. Check out the OIG's website for written statements and recordings of opening statements for all OIG congressional testimony. Meanwhile, the Office of Investigations had several investigative updates in January. An investigation by the VAOIG and Michigan Attorney General found that 3 individuals used aliases to obtain or create fraudulent documents, including vital records such as birth certificates, to make it appear as if they were the surviving spouses of deceased veterans. These documents were used to fraudulently obtain VA dependency and indemnity compensation benefits, VA survivors' pension benefits, and unclaimed funds from Michigan. One of the 3 individuals pleaded no contest to conducting a criminal enterprise and false pretenses for defrauding VA and the Michigan Department of Treasury. Pursuant to the plea agreement, the defendant will be sentenced to serve between 6.5 to 20 years of incarceration and be ordered to pay $470,000 in restitution. Of this amount, VA is due to receive $430,000. In a different case, an individual received VA dependency and indemnity compensation benefits intended for his grandmother due to both her husband's and her son's military service. A review of the grandmother's bank records revealed that for nearly 30 years, the grandson used her VA benefits for his own personal expenses after she passed away in November 1993. The loss to VA is more than $340,000. Following an investigation by the VAOIG, the grandson was sentenced in the Western District of Missouri to 20 months of home confinement, 5 years of probation, and over $340,000 in restitution after previously pleading guilty to theft of government property. In January, the VAOIG published 16 reports. I'll highlight a few of them now. From the Office of Audits and Evaluations comes a report titled VA should enhance its oversight to improve the accessibility of websites and information technology systems for individuals with disabilities. VA is required by law to make information on its websites, related resources, and data systems accessible to people with disabilities. The OIG conducted this audit to address concerns from Congress and a veterans service organization about the accessibility of VA websites and information technology systems. The OIG found areas where VA's efforts in monitoring of Section 508 requirements could be improved to ensure websites and information technology systems are equally accessible to all. Specifically, web managers did not routinely maintain the web registry, VA's official repository of websites, as required, and websites were not consistently scanned for compliance until recently. VA officials also did not always keep administrations and staff offices apprised of requirements and related procedures, resulting in non-compliant VA information technology systems and an inaccurate VA systems inventory, which designates systems as Section 508 compliant, non-compliant, or unassessed. Finally, 3 directives were not recertified within the required timeline. The OIG made 6 recommendations to address these shortcomings and safeguard accessibility. The VA OIG's Office of Healthcare Inspections reviewed national and healthcare system guidance issued by VHA regarding the inpatient management of alcohol withdrawal. Determining a patient's severity of alcohol withdrawal is critical in facilitating treatment decisions that may prevent the progression of symptoms that could be fatal. Current VHA guidance does not specifically address inpatient management of alcohol withdrawal, which does not fall under a single VHA national program office. The OIG found healthcare systems lacked written guidance to assessing alcohol withdrawal severity, determining the appropriate level of care, evaluating co-occurring conditions, consulting with substance use disorder experts, and administering drug therapy interventions. VA's Undersecretary for Health concurred with the OIG's 3 recommendations to identify a national program office for the oversight of alcohol withdrawal management in inpatient settings, to develop written guidance that includes expectations for determining alcohol withdrawal severity, level of care, and when transfer of care is indicated, and to implement related training for inpatient staff. The VA OIG published management advisory memoranda on monthly housing allowances for veterans, VA's initial allocation of toxic exposures funds, and concerns with using VA's new financial and acquisition management system known as IFAMS. We also published several comprehensive healthcare inspection program reports focused on VA medical facilities in Indiana, Florida, Delaware, Wisconsin, California, South Carolina, and Puerto Rico. To read these reports, visit our website at vaoig.gov and select the Reports tab. I'll wrap up January's highlights with a featured hotline case, which substantiated allegations of resident abuse and a hostile work environment at the Tucson VA Medical Center's Community Living Center. The OIG hotline received allegations that residents of the center were subjected to systemic verbal and physical abuse by VA staff and contractors, and a hostile work environment prevented some staff from reporting the abuse that could have helped to protect residents. Allegations and supporting evidence were sent to Vision 22, the Desert Pacific Healthcare Network, for review and response. Following staff interviews and a review of records, witness statements, and VA police reports, a Vision team substantiated that verbal abuse and unprofessional conduct had occurred, and that a hostile work environment did prevent some staff from raising concerns about residents. The team recommended 14 corrective actions for the medical center director to review, implement, and monitor. The corrective actions included establishing an orientation and continuing training program for center staff and retraining managers on responding to and addressing concerns of resident abuse, unprofessional conduct, and bullying in the workplace. Thank you for listening to January's highlights. Visit our website for all VA OIG podcast episodes.
This has been an official podcast of the VA Office of Inspector General. Veteran Oversight Now is produced by the Office of Communications and Public Affairs. Tune in monthly to hear how the VA OIG serves veterans, their families, and caregivers through meaningful, independent oversight. Check out the website for more on the VA OIG oversight mission. Read current reports and keep up to date on the latest criminal investigations. Report potential crimes related to VA, waste or mismanagement, potential violations of laws, rules or regulations, or risks to patients, employees, or property to the OIG online or call the hotline at 1-800-488-8244. If you are a veteran in crisis or concerned about one, call the Veterans Crisis Line at 1-800-273-8255. Press 1 and speak with a qualified responder now.